Mpox, previously known as monkeypox, is an infectious disease that has garnered global attention in recent years. In this video, we'll explain where Mpox comes from, how it spreads, the ways you can prevent it, and the treatments available today. Mpox was first discovered in 1958, when outbreaks occurred in colonies of monkeys used for research, giving it the name monkeypox. However, it's important to note that Mpox is primarily transmitted from animals such as rodents and not just monkeys. The first human case was recorded in 1970 in the Democratic Republic of Congo. Since then, most cases have been reported in Central and Western Africa, but in recent years, the virus has spread to different parts of the world. Mpox belongs to the same family as smallpox, though it is less severe and less contagious. Its symptoms include fever, headache, muscle aches, swollen lymph nodes, and a rash that develops into lesions. Mpox is a zoonotic disease, meaning it is transmitted from animals to humans. The virus can be spread through direct contact with the bodily fluids or lesions of infected animals or people. Human-to-human transmission can also occur through close contact, such as touching the lesions, respiratory droplets, or contaminated objects like bedding or clothing. It is important to remember that, unlike COVID-19, Mpox is not primarily spread through the air, but rather through physical contact with infected individuals or animals. While Mpox is not as easily transmissible as other viral diseases, there are several preventive measures you can take to reduce the risk of infection. First, avoid contact with wild animals that could harbor the virus, especially in regions where Mpox is known to occur. Second, practice good hygiene. Wash your hands regularly with soap and water, and use alcohol-based hand sanitizers when soap is not available. Third, avoid contact with the bodily fluids, lesions, or clothing of infected individuals. Fourth, healthcare workers and those in contact with infected patients should wear protective clothing, including gloves, masks, and eye protection. In some cases, vaccination can help. The smallpox vaccine has been shown to be about 85% effective in preventing Mpox, and some countries have approved it for use in certain high-risk populations. The symptoms of Mpox typically appear within 1 to 2 weeks after exposure and begin with fever, fatigue, headaches, and muscle aches. After a few days, a rash develops, usually starting on the face and spreading to other parts of the body, turning into fluid-filled blisters. To diagnose Mpox, healthcare professionals will typically examine the patient's symptoms and take samples from the lesions for laboratory testing. Most cases of Mpox are mild and resolve on their own within 2 to 4 weeks. However, supportive care can help manage symptoms, including fever reducers, pain relievers, and ensuring proper hydration. In more severe cases, antiviral medications like tocopherol have been approved for treating Mpox. This is especially useful for individuals with weakened immune systems or those at high risk of complications. It's important to seek medical care if you suspect you have Mpox or have been in contact with someone who has it. While Mpox is a concern, it can be managed and prevented with the right precautions and knowledge. Stay informed, take preventive measures, and seek medical care if needed.